a challenge to dignity. Our goal was to link academics, activists, and agencies concerned with the health of refugees and asylum seekers in a spirit of collaboration and comparison, bringing together professionals working with different populations of forcibly displaced peoples, ethnic groups, and nations. The video you are watching will contain an individual presentation edited to stand alone. We hope you find them to be of value.
Dr. Bojorquez is a professor researcher at El Colegio de la Frontera Norte. And Dr. Sepulveda is the professor at Global Health and the director of the UCSF Institute for the Global Health Sciences. And Dr. Strathdy is Dean of Global Health Sciences and a professor of medicine at UCSD. And their talk today is titled Prevalence of SARS-CoV-2 Antibodies in Migrant Populations in Tijuana. I'll turn it over to y'all.
Thank you. Good afternoon, everyone. I'm glad to be here. Well, not in person, but I'm glad to be able to share some of our work with you. And I'm going to share my screen. So please let me know when you can see it. Is that okay?
Yes, we can see it.
Okay, perfect. So, well, the names of the presenters the three presenters are part of the group of researchers that conducted this study, but I want to emphasize that this was a study that had that a lot of people working in, and it's the result of a big collaboration between different researchers and research assistants and etc. So it's important to notice that all of them were part of this effort. And the presentation is called Prevalence of SARS-CoV-2 Antibodies in Migrant Populations. And there are two reflections I want to share with you too. The first one is about this distinction between migrant and refugee and asylum seekers, which is it's a difficult distinction to make for many reasons. And that was one of the difficulties in our study. So I'm going to speak a little bit more about it later. And the second reflection I will share is about the importance of having data on this population and the difficulties of having data on this population. And I'm talking about epidemiological data now. So a little bit of background. It is already known that migrants have been disproportionately affected by the pandemic, by the COVID pandemic. But most studies have been conducted among migrants who are already in their destination countries, and much less is known about people in transit or who is staying in between places such as Mexico or the northern border of Mexico, which is the place where we conducted our study. And it's also already known that some populations might be especially at risk of transmission, amongst them the ones living in refugee camps or similar locations which share in common the fact that people are staying in overcrowded spaces and also in difficult conditions of hygiene, of alimentation, etc. So it's populations that are especially at risk of transmission. But still, most research on these matters has been done in high-income countries, or the countries that are the countries of destinations for these populations, and much less is known about what is going on in middle and low-income countries, so it's important to provide information on that. And there are some possible research questions that are still not answered, which are, what's the prevalence of infection among migrants in these groups I'm talking about? And especially if this prevalence is different to the prevalence among non-migrants. And why is this important? Because this will be a pointer to a situation of inequities in health if migrants are especially affected. No? So are some groups of migrants especially affected? That's also important to know. And we still don't have a lot of data on that. So that's the importance of this research. So our main objective in this work was to determine the prevalence of SARS-CoV-2 antibodies among migrants in Tijuana. And we conducted a cross-sectional study, a survey. It was not a non-probability survey. We worked with people who were staying in shelters in Tijuana, and also people living out of shelters, but who were also migrants. And for this, we partnered with the La Frontera study, which is led by Dr. Stephanie Strati. So we were able to gather information about two different populations. And I think that makes it even more interesting because we can even establish comparisons between these two types or two groups of migrants. Our study was conducted from November to December in 2020, and then we started again. We had to stop because of the epidemic, because of the increasing cases of COVID. So we have to stop because of hygienic considerations, and then we started again in February, April 2021. And the main thing we did was collect blood samples for testing and testing the samples for SARS-CoV-2 antibodies, which were processed in this lab in San Diego. But we also had nasal swabs for SARS-CoV-2, for current infection of SARS-CoV-2, and rapid HIV tests and tests for latent TB. And the questionnaire we used had questions on sociodemographics, but also a set of questions about migration, including migration status, the plans to apply for refuge or asylum in Mexico and the US, experiences of violence, health status and access to healthcare, mental health, drug use, and COVID-19 knowledge and practices. So it was a very, very ample questionnaire with a lot of information that we expect to be able to share in the near future. So, as I said, we were talking or referring to our population as migrants, but we tried to make the inclusion criteria in such a way that we were targeting what we consider to be the more vulnerable population in this context, and that will be very similar. Probably there's an overlap between this population and what we can call asylum seekers in the strict sense of, I mean, people who is already in the process of asking for asylum. So we choose to work with persons either born in a Latin American or Caribbean country, which was not Mexico, and who had been living in Tijuana for 5 years or less. Or they could also be born in Mexico, but in some state, any state other than Baja California, where Tijuana is located, and had been in Tijuana for 1 year or less. And they have to fulfill the criteria of having been, having arrived into Tijuana because they had been deported from the US or displaced from some other area of Mexico. So the idea was to have persons in transit from other countries and who were trapped in Mexico, but they were mainly aiming to go across to the US, or Mexicans who had been deported or were internally displaced. So this is the population we were targeting in this study. We were working only with adults, 18 years old or over, and able to respond in either Spanish, English, or French. We had the questionnaire in each one of these languages. These are some general characteristics of participants. And I have this comparison between those we surveyed in shelters and the ones we surveyed who were living out of shelters. And so we have a very different population in these two kinds of spaces. So for example, in the shelters, we had more females than males. We had most interviewees had dependent children with them in Tijuana. Most interviewees were asylum seekers or were aiming to apply for asylum in the US. And the proportion of people who had been born in Mexico was much lower. On the other hand, the ones we interviewed out of the shelters were mostly males. Only a few of them have dependent children with them. There were no asylum seekers in the sample, and most of them had been born in Mexico. So the population out of shelters were mostly composed of deported Mexican migrants who had been deported from the US to Mexico, and the persons in shelters were more likely to be asylum seekers, non-Mexican, and traveling in family groups with children. Many of them were female, so it's a different population. The mean age even was different. The group out of shelters was slightly older than the group we interviewed in shelters, and we have over almost 500 participants overall. Now, as for some social characteristics and the impact of COVID-19, well, those who were staying in shelters, among those who were staying in shelters, only about a third were working at the time of the survey. Only 10% of them had ever slept in a risky place, and by risky place we were referring to in the streets, in a car, in a vehicle. So it's not the exact definition of homeless, but it's close to the definition of having been homeless at some point. While those living out of shelters had a much higher proportion of persons who had even at some point in the past months had to sleep in these types of risky places. Now, almost all those out of shelters have been in migration detention, and this is because they were deported mostly, but 50% of those in the shelters had already been in migration detention, either in Mexico or in the US. So this was also a very common experience. And then we have a series of questions about what we call social impacts, which were, did you lose your job or your source of income because of the pandemic? Have you experienced decreased income? Have you experienced difficulties finding a place to stay, etc.? And what we can see is that almost all participants in the shelters reported having experienced one of these impacts as a result of the pandemic. So the social impact of the pandemic had been huge among this population. And among the population living out of the shelters, only, inverted commas, only half of them had experienced any social impact. And that's probably because they had been in Tijuana for a slightly longer period, or maybe had some different networks that they could rely on, them being Mexicans. And then about the impact, migration impact, was a variable composite of if they had seen their migration processes interrupted because of the pandemic, and 1/5 of those in the shelters reported that. And also we asked if they have experienced an increase on their experiences of violence. And this could be any type of violence, either gender-based, within the family group, or also in the hands of the police or any authorities, or crime or anything. But what is really impressive is that almost 38% of those in shelters reported that they had experienced some increase in violence, or the experiences of violence because of the pandemic. And almost a third of those out of shelter. So there was an important increase in experiences of violence. Now, as for the main objective of the study, which was the seroprevalence of SARS-CoV-2 antibodies, well, in the total sample, the seroprevalence was 54.1%. So slightly over half of the whole sample had already experienced contact with the virus. It doesn't mean necessarily that they had experienced COVID, the disease, or that they had noticed that they were infected with the virus, but over half of them had already been infected by the virus. And we didn't find differences by gender, by working status, by the experience of having slept in a risk place. But we did find a difference between those who had been and hadn't been in migration detention, with those who reported having been in migration detention, having a higher prevalence of SARS-CoV-2 antibodies. And I think this is very important because this provides support for the idea that migration detention is a risk environment for the transmission of SARS-CoV-2. So it's an important thing to address. And the other thing was that those who had been in Tijuana for over 1 year or 1 year or more were much more likely to have antibodies to SARS-CoV-2. So there are, we could advance different hypotheses of why this was happening. One of them would be that maybe they had time to interact more with in different places in the city where transmission was occurring. And, and another will be that they were being infected because maybe because of migration detention, but also because of work, because of using public transportation, etc. But it's an interesting thing because it seems to point to Tijuana as a risky environment for the transmission of COVID. No? So we cannot make any strong conclusions from this, but I think it's an interesting thing to share. So just to compare, in my previous slide, as I said, we had over 50% of prevalence of SARS-CoV-2 antibodies. And in comparison, this survey, the Ensanud COVID, which was conducted in the second half of 2020, and it's a representative survey of the whole population of Mexico, it was reported that the seroprevalence of SARS-CoV-2 was 25%. So what we find is that migrants had double the prevalence of SARS-CoV-2 as compared with the population in Mexico. So this points to migrants as an at-risk population and a population that needs to be addressed in efforts of prevention. No? There was also a survey that we did in 3 cities in Baja California, in Mexicali, Ensenada, and Tijuana, in February 2021. And the seroprevalence there, and this was a household survey, so this is like the general population of the 3 cities, and the seroprevalence was 21%. So again, it was much more lower than the one in the shelters, and also out of the shelters, the one in migrants. And there's another study that was conducted in the facilities of the IMSS, which is the Social Security Health Services in Mexico. And in that study, they found a prevalence of 33.5% for the whole of Mexico and 40.5% for the northern region of Mexico, which includes Baja California. So this is this last one is a survey in healthcare facilities. So of course the prevalence is going to be higher, but it still is lower than the one we found in the migrant population. So again, the main conclusion is that migrants were indeed an at-risk population for transmission of COVID. And I don't know if I have a lot of time yet, but I'm going to go very quickly over this, because this is my second point, that we really need to gather more information about the epidemiology of SARS-CoV-2 and of course other diseases among migrants. This is a study we did very early in the beginning of the pandemic, and we were trying to analyze how much had migrants been impacted by the pandemic. And what we did was to use information from the public database of COVID cases in Mexico and try to extract to approximate the incidence of COVID, or of infection, of SARS-CoV-2 infection among migrants, and compare it with the incidence in the Mexican population. And what we found is that it was very difficult to calculate that because we don't have a denominator. We had a number of cases, but we didn't know what the population was. So it was very difficult to get a feeling of this. But we were able to do some scenarios, and we found things as different as the migrant population is very similar to the general population, or the migrant population has double the incidence of the general population, which is closer to what we found in the current study. So I think this is just to point to the importance of having data. And even within the database of the Ministry of Health, this database, we're trying to identify migrant persons in this database. And I'm sorry, this one is in Spanish, but what it's showing is that in that database, there were very few cases of migrants, but also the cases of migrants were milder in a sense. There were less hospitalizations, less deaths, and migrants tend to have less health conditions that could put them at risk of more severe cases of COVID-19. So to conclude, migrants were disproportionately affected by the COVID-19 pandemic in terms of seroprevalence, but also in terms of the social impacts. outbreaks and cases might have gone undetected because they were mild, because of the conditions I was telling you about in the previous slide, but also because of limitations in access to healthcare. It is possible that there were many cases that never sought healthcare, so they went undetected. So probably my main conclusions in terms of the epidemiology is that more data collection is required. So I will finish with this, and this is just an acknowledgement of the many people and organizations that took part in this research. Thank you very much.
Thank you. Thank you very much for sharing your very interesting study with us. Are there any questions?
I do have a
Yes.
comment. Well, thank you so much for your presentation, Yetza. Very interesting to see that. And I was wondering, when you were talking about the difference, like being in a migration detention was like more, they were at highest risk. But was there a comparison when you shown that graphic? There was not a difference in between those living in shelters and out of shelters, so was not a factor considered in regards to that, or why it was not like considered like to explore that. And also the last one about the outbreak, when you said, I was thinking that through your presentation that not having access to be tested or not having access to healthcare or needed to continue like their ordinary lives, even if they had mild symptoms. So something that has to do as well with their social dynamics and their ordinary life and the accomplishments they need to cover, like something related to that as well.
Mm-hmm. Yeah, well, first, regarding the comparison between those in shelters and out of shelters, the prevalence was slightly higher among those out of shelters, but it was not statistically significant. So that was one thing. And the other thing is that, I mean, the reasons why shelters or refugee camps, etc., are considered risky environments for the transmission of any virus is mainly because of overcrowding and sanitary conditions. And well, that's something that migrants living in shelters had experienced up to a point. Even if the shelters in Tijuana did a really good job of trying to protect migrants, so they implemented a series of measures to preserve the sanitary conditions, trying to separate people in the dormitories, etc. But still, there were I mean, a lot of people going in and going out and contact between different persons. So there were a lot of chances for transmission. No? And also, some shelters closed their doors. I mean, they became like places to shelter in place for the migrants. So they were closed during the worst periods of the pandemics. And there were very few outbreaks during that period, but still people staying in shelters could have experienced and contracted the infection before they came to the shelters. That could have happened, no? Probably, for example, in detention places. And so as we were measuring prevalence, we don't know exactly when the contagion took place, so we can say a lot about. I don't know if I answered all your questions.
Yes, the other one was just a comment that I, through your presentation, I was thinking about why it was easier to have an outbreak with the migrant population, and because of the transmission, not having access to healthcare, to test, and to other resources to stop the transmission.
Yeah, the other thing I want to stress is that migrants, I mean, they have less access to healthcare in general than the Mexican population. But during this outbreak, there was a very concerted effort by the health authorities, the local health authorities, public health authorities, to prevent outbreaks in shelters. They were really concerned about this issue. So they were very rapid to respond to any I don't know, when there seemed to be an outbreak. So there was relatively a lot of testing in the shelters as compared with the general population. And that might be one reason why the cases that are reported in the database are milder than the cases that were reported for Mexicans, because these were cases that were sampled precisely because there was a suspicion of an outbreak and they wanted to stop it soon. So there are a lot of issues with the official data that make it difficult to interpret. So that's why I think studies such as the one we did are very important, because they offer us a much clearer picture of what was going on.
I just wanted to make a comment. Oh, sorry. Can you hear me? Can you hear me? Yeah. I just wanted to make a comment. I was in Tijuana a week ago, and people are very cautious about wearing masks. And you cannot even go into any store if you don't have a mask. And people will actually be like, please step out, or they get really upset. And I was surprised people are really worried and very cautious about the disease. Wearing masks. They don't want you to go in the store, everything. And just wanted to comment on that. They were very careful about catching the disease, because some locals told me, I was talking to them, they said because we don't really have vaccinations like the States, so we're really worried about that. I don't know, that's just what they were telling me. Thank you.
Okay, thank you. Are there any more questions? Okay, thank you so much for your talk. We really appreciate it.